Hi, I am Bree. Welcome to this episode, everyone. Welcome back, Alex. Today we will focus on heart disease in women. I think many people still don't realize it's the leading cause of death for women worldwide. Why is that fact so underdiscussed? What do you think, Alex?
It's wild because heart disease kills more women every year than all types of cancer combined. Globally, we're looking at around 8.5 million women dying from cardiovascular diseases each year. That's roughly one-third of all female deaths. But here's the kicker: when you ask women what their biggest health threat is, most will say breast cancer, not heart disease. In fact, only about 56% of women are even aware that heart disease is their number one risk. That's a huge awareness gap. Symptoms in women are different, so it's often misdiagnosed or ignored.
That's honestly shocking. Different how? What symptoms should women be watching for? And I've heard that heart attacks in women often don't present with the classic symptoms we see in media, right?
Exactly. And this is where things get really tricky. For women, a heart attack might not be that dramatic clutch your chest moment. Instead, it could feel like just being incredibly tired, short of breath, even a bit nauseous. I mean, imagine feeling fatigued or having jaw pain and being told, it's probably just stress. That happens way too often. Studies have shown that women under 55 are about 50% more likely than men to be misdiagnosed in ERs when they come in with heart attack symptoms. These can be subtle and easy to dismiss as just stress or exhaustion.
That sounds like a recipe for misdiagnosis. Is there data on that?
Yes. Women under 55 are 50% more likely than men to be misdiagnosed when they come to the ER with heart attack symptoms. And when they are diagnosed, young women have higher in-hospital death rates compared to men.
That's a huge number. So, essentially, women are being sent home when they're actually having a heart attack?
Sadly, yes. And it's costing lives. There was a study, this really hit me, showing that young women who have heart attacks are more likely to die in the hospital than men of the same age group. It's not because their hearts are weaker, it's because their symptoms are overlooked, or they get delayed treatment.
Is this because medical research was male-centric for so long?
Exactly. For years, clinical trials excluded women because of hormonal variability. That led to diagnostic protocols being built around male symptoms. Even now, women make up only about 38% of participants in cardiovascular drug trials.
That's so frustrating. So, what about risk factors? Are there specific things that put women at higher risk that maybe aren't common knowledge?
Oh, absolutely. Of course, we have the usual suspects like high blood pressure, high cholesterol, smoking, right? But for women, there are unique factors that don't get enough attention. For example, pregnancy complications, like preeclampsia or gestational diabetes, can double the risk of heart disease later in life. Then there's early menopause, which affects heart health dramatically. And autoimmune diseases, things like lupus or rheumatoid arthritis, these hit women way more often and are linked to heart disease too. Yet, they're rarely factored into routine heart screenings.
It sounds like it's not just a medical issue, it's a research gap too.
Oh, 100%. For decades, most heart disease research was done on men. Women were underrepresented in clinical trials. Even now, women make up only about 38% of participants in cardiovascular drug trials. That's ridiculous when you think about it. Our bodies are different. Hormones, immune responses, even how we metabolize medications, it's not a one-size-fits-all. But that's how treatments have been designed. We need more gender-specific research, period.
So, what can women actually do? Like, right now?
First, know your numbers: blood pressure, cholesterol, blood sugar. Second, listen to your body. If you feel something's off, don't brush it aside. Advocate for tests. And of course, maintain a heart-healthy lifestyle: exercise, balanced diet, managing stress, no smoking.
So, is there hope? Are things starting to shift in terms of awareness or care?
Yeah, there's definitely progress. Campaigns like Go Red for Women by the American Heart Association have been pivotal in raising awareness. But we need more than just awareness, we need action. Doctors need better training on recognizing women's heart symptoms. Medical guidelines need to be updated. And women need to feel empowered to advocate for themselves. If you feel like something's wrong, if you're feeling off, even if it's not the textbook signs, push for answers. Heart disease doesn't discriminate, but unfortunately, the system often does.
That's such an important message. And this conversation? It's just the start. We will discuss other major health disorders in details in next episodes. If you have found this episode helpful, please like, share and subscribe. Till then, stay healthy and aware.